Good morning, members of Parliament and members of the Committee of Public Health, Social Development and Labor, support staff, radio listeners, TV viewers, and those viewing via various forms of media. Welcome to this committee meeting of today, number 7 of Thursday, June 30th, 2022. A special welcome to the Minister of Public Health, Social Development and Labor, Minister Omar Otley, and his support staff. We've established a quorum of 7 members. Please stand for a moment of silence. Thank you. I've received notice of absence from the following members: the MPs William Marlin, MP Angelique Romou, MP Christophe Emmanuel, and I've received also notice of lateness of MP Hyacinth Richardson. Are there any other notifications? We have MP Westcott Williams.
Thank you, Mr. Chairman, and a good morning to you, a good morning to our staff, a good morning to my colleagues in Parliament, and a good morning to the Minister of VSA and his entourage. Thank you for being here this morning, Minister. Good morning to all tuned in to this committee meeting. Mr. Chairman, allow me to use this opportunity, because I will not get it from this vantage point again, and that is to extend congratulations and best wishes to the entire population in advance for Emancipation Day. Mr. Chairman, Emancipation Day, which is a holiday, also signals the recess of Parliament, and this is where I want to make my point. It's unfortunate that Parliament is going on recess with so many urgent issues hanging. For example, the fact that the payment of vacation allowance, which took place to the civil servants and public school teachers, and the need for the law to be changed to legitimize this action by government. Mr. Chairman, any self-respecting government would have at least asked Parliament's permission to basically act ahead of a law being changed. In addition to that, the discrimination that has now come about with the non-public school teachers who are not able to get their vacation allowance is also something that, in my opinion, any self-respecting government would have sought to avoid. It hasn't happened. Mr. Chairman, if we, for whatever reason, if the government is going to request Parliament to come in during recess to deal with any of these 2 matters, by the way, the one regarding the public servants, so the civil servants, that one is at the Council of Advice. I have not seen the law regarding the cutting of the salaries of those in the semi-public sector, so in other words, the subsidized school board. I haven't seen that law yet reach to undo that so that those persons too, those teachers too, can get their vacation allowance. I haven't seen that anywhere close to coming to Parliament yet. Mr. Chairman, we have had some reports and some presentations here in Parliament recently regarding the developments taking place on St. Maarten that are worrisome. But I guess everybody is happy that Parliament is going on recess. At least the government can continue with the way it has been operating, with total disregard for Parliament and the role of members of Parliament. Be that as it may, I want to see what the government is going to ask Parliament to come back during recess and do. And it better include some of the things that I mentioned before. Thank you, Mr. Chairman.
Thank you, MP Westcott Williams. Are there any other notifications from members at this time? That not being the case, I'd like to go over to the agenda points for this meeting. We have as agenda points 4 agenda points originally. The first is status of amendment of the ordinance regulating the short-term contracts. That was IS 077, dated October 10, 2021. Agenda 2 is the current status of the mental health sector on St. Maarten. Agenda 3 would be the presentation on policies and ordinances that directly relate to the mental health sector. And 4, discussion on the areas of improvement specifically as it relates to ordinances and policies. The agendas 2, 3, and 4 are related to IS 471, dated January 19, 2022. Agenda point 1 was requested by MP Pantophlet, and agenda points 2, 3, and 4 were requested by MP Romou. Before we go over to the agenda points, the minister did indicate to Parliament, and also in discussion with the requester of agenda point 1, to have some more time to prepare a very comprehensive presentation regarding short-term labor contracts and all that that encompasses. And in that discussion, the requester has agreed to allow the minister to return after the recess, hopefully shortly thereafter, to handle agenda point 1. Therefore, members of Parliament, we would then actually adjourn agenda point 1 and go straight into agenda point 2. I see a point of order from MP Westcott Williams.
Thank you, Mr. Chairman. Mr. Chairman, I hear your request and that of the minister and the requestor of the meeting as well. But, Mr. Chairman, in this context, I have a question, and I'm sure the minister can answer it. Some time ago, Parliament passed a change to the Civil Code regarding labor, and this needed to be put into force by the ministry. From what I have been able to determine, I haven't seen it publicized, I haven't seen it anywhere, and I would like to know if the minister can tell us the status of that change to the labor book in the Civil Code. Thank you, Mr. Chairman.
I think we can maybe just briefly on that point in terms of not a full, of course, explanation, because like I mentioned, the minister does plan in discussions with the requester and me as chair that he would want to do a full comprehensive explanation on the status, but just briefly, Minister, if you just comment what the status is and that and confirming that you'll be returning to handle that agenda point.
Thank you, Mr. Chairman. Thank you, honorable members of Parliament. The Civil Code right now, we're in discussion with the Justice Department, who has it and is going through the legislative review for publishing.
Okay. Thank you, Minister. So therefore, members of Parliament, I would like to adjourn agenda point 1 and go over to agenda point 2. Yep. We then go over to agenda point 2. On January 19th, what's that? Oh, actually, just as another note, while we are going to agenda point 2, additionally, I would like to propose that we include agenda point 4 into agenda point 3, as it deals with policies and ordinances as well. So again, I'll include agenda point 4. I'll read that one more time. That's discussion on the areas for improvement, specifically as it relates to ordinances and policies, will then be combined with, what was agenda 3? Double-sided. It would be combined with agenda 3, which was a presentation on policies and ordinances that directly relate to mental health sector. I have another point of order from MP Westcott Williams.
Yeah, thank you, Mr. Chairman. Mr. Chairman, if the minister could be a little more clear with respect to his answer, this ordinance passed by Parliament, in response to Parliament, the minister put in writing that it was his intention that that new book in the Civil Code goes into effect the 31st of March. We have that here in Parliament, for a statement by the minister. So now I really can't understand this issue of a legislative review. The government just needs to decide when it goes into effect. So if the minister can please explain what is the issue with that that ordinance adopted by Parliament changing the Civil Code to address, and let us understand what we're talking about, to address the period for which persons can be given a short-term contract. So it ties exactly into the presentation to be made by the minister, as well as extending maternity leave and instituting paternity leave.
So specifically, you want to know the status on the ratification and implementation of that particular legislation, just to understand your question?
Yes, and the status about a review, a legislative review, something passed by Parliament. All the government needs to do is establish what date it is going to go into effect. The minister a couple of months ago responded and said by the 31st of March. Okay. So I just would like to know what's the issue with ratifying, putting into force that ordinance. Thank you, Mr. Chairman.
Okay, I'll give the floor once again to the minister. I do want to try to prevent, because then just like you may have questions, other members will end up having questions and it goes into a discussion, but I understand your question. So just again, briefly, if you can state on the status, and then I would ask if we can please move to the next agenda point.
Yes, definitely. Mr. Chairman, all of the points noted by MP Westcott is taken. All of the points are very much serious. It has have the attention of VSA. However, the going into enforcement is not by the Ministry of VSA, it's at the Ministry of Justice. At the time of discussion, there were legislative capacity issues in the Ministry of Justice, which has since been rectified, and an email has been sent that they are now going through it in order to put it into force. Thank you.
Okay.
Yes, so any other further information for the sake of this meeting, I'll be happy to send to the MP in writing, or the MPs in writing.
Okay. Thank you, Minister. So once again, we will be combining, we will propose to include agenda point 4 into 3, and Minister, we will be dealing with agenda point 2 and 3 today. Yeah? Yes?
If I may, Mr. Chairman, because of the agenda points, if the Parliament allows me, the presentation kind of is incorporated. So I would like to just, if we can just do it all together, because...
So the 3 aspects of mental health, because we have 3...
It's kind of all, yeah.
We have 3 agenda points, members of Parliament, as it was requested. The current status of mental health, then you have a presentation on policies and ordinances, then you have areas of improvement. I think what the minister is suggesting is that we handle all 3 of those topics, which are very interconnected, as one agenda point. Are there any objections to that? I think that should be okay. Then, Minister, that's what we will do. So just for us to note that we are now combining the agenda points 2, 3, and 4 into one agenda point, which will be the current status of mental health sector in St. Maarten. Yep, okay? All right. So we go over to agenda point 2, if there are no objections, which is now a combined agenda point simply as current status of mental health sector on St. Maarten. On January 19, 2022, Parliament received a letter from the MP Romou with the request that a meeting of the Committee of VSA be convened to discuss the aforementioned agenda points. The 3 agenda points as was requested were 1, current status of the mental health sector on St. Maarten. As I stated earlier, however, we have now combined that agenda point and we will be handling all the topics related to agenda point 2, 3, and 4 under the agenda point current status of the mental health sector in St. Maarten. The minister has a presentation and was requested to be present. He is here with his presentation, hence the agenda point. Normally at this time, I would give the word to the requester of the meeting as is customary. However, she has given notification that she is unfortunately not able to be here today. So then I will then give the floor to the Honorable Minister of VSA or any of his support staff to give a presentation.
Thank you, Mr. Chairman. Again, good day to honorable members of Parliament. I must say, the initiator of this meeting reached out and informed me that she would be absent due to an emergency. So that was highly appreciated and respected on behalf of MP Romou. Today I have here my staff members. I also have representative from the Mental Health Foundation and the consultant, as well as my cabinet staff. This is a very important meeting, so without further ado, we'll go straight into it. Agenda point 1, current status of mental health sector on St. Maarten. The outline of the presentation is as follows. I'll provide an insight on the current status of mental health on St. Maarten, provide an overview of the current legislation on the island, the objective of the vision for mental health reforms moving forward, and an overview of the current legislation affecting mental health. Currently, over 200 professionals working in the sector, in the mental health sector, from social workers, house doctors, psychologists, psychiatrists, nurses, ambulance, pharmacies. Healthcare institutions currently offering services specifically towards mental health are Mental Health Foundation and now PsyCare. APAP, the Association of Psychologists and Allied Professionals, along with the Social Workers Association and all other members, serve as a key preventative part to our mental care sector. Mental Health Foundation is the only facility to treat patients with severe illnesses that require inpatient care with a capacity of 1 room. Currently, 2 rehabilitation centers for persons suffering from substance abuse. To develop a holistic care model with mental wellness focused services and facilities that prevent the development of mental health challenges, promote adolescent and adult social emotional. You're on the right, okay. Let's skip one. Go back to it. Apparently I skipped one, but I'll read it off of the computer.
I think
This
if
one?
the presentation needs to go back?
Yeah,
Or is
go back
good?
one.
It's good there? Yeah.
Okay. Current status of mental health sector continued. Mental health requires serious financial and technical investment. NRPB project 8 million towards the overall improvement of the capacity and building of the facility for Mental Health Foundation. The objective of this project is to improve the capacity of mental health services and delivery. One of my favorite slogans is that we are not only focusing on a building, but the quality of care needs to match that of the quality of the building. On the short term, we are working with mental health to strengthen their current services. In 2021, an evaluation of the sector was carried out. And with this finding, we were able to make adjustments or plans for 2022. In 2022, the shareholder discussion have begun. Data derived from these consultations will be used to update a 4-year multi-annual plan. A technical work group was established to focus on mental health and psychological support. In the event that the national emergency or crisis would occur, mental health focal point was hired to coordinate and execute these activities. Good. Mental health care vision is to develop a holistic care model with mental wellness focused on services and facilities that prevent the development of mental health challenges, promote adolescent and adult social emotional development, address social emotional problems that currently exist, and to provide quality health care to those in need of outpatient or inpatient care related to mental health illnesses. Mental health reforms objective are to strengthen effective leadership and governance for mental health, integration of mental health care into coordination of care between providers that will improve health outcomes, to provide comprehensive, integrative, and responsive mental health care, to implement strategies for promotion and prevention of mental health, to strengthen information systems, evidence, and research for mental health, to empower persons with mental health disorders. Mental health reform and activities address outdated mental health legislation, as we recognize that mental health care legislation needs to be modernized. I think this is very important and an important acknowledgement from the ministry. I would like to repeat this one. We will address outdated mental health legislation as we recognize that mental health care legislation needs to be modernized. Strengthen primary care to prevention programs, build new facilities. The big legislation, we would be adjust to be able to recruit qualified mental health specialists from around the world and not just a selected region. Support the mental health care institution in strengthening their operational protocols and procedures. This is already in play. To create community-based approach to combat the stigma associated with mental health challenges. The outreach community-based approach is very important. These are, for instance, areas where we see in St. Maarten, we have an increase of young men and women that are on the street corners, and now we are trying to create legislation and policies that would allow us to directly be in contact with this person and families' education system to offer these help. And sometimes it only comes to the minister when it's a gazette. What is a gazette? When it's too late, when the doctor is saying that the person is now a danger to themselves or others. So we are now seeing that we need to step in way before it is too late. So this is one of my my favorite out of it. The community approach is inspired by a convention of Alma Ata in 1978 and the Convention of Caracas 1990. Country plans embedded community-based approach, empirically research and develop desired results, lessen burden on crisis, use as access to primary care, promote shared responsibility, transition away from traditional approach. Go to the next one. Mental health reform activities. Development of comprehensive mental health service network with emphasis on primary care. Very, very important. Primary care is key. Update multi-annual mental health plan. Update quality standards of protocols in mental health. Update the referral system. I would like to take it straight to agenda point 2, what was supposed to be agenda point 2 in the current legislations and ordinance that directly affect mental health sector. Next one. We have the temporary national ordinance limiting the establishment of medical professionals. This legislation provides procedures for medical professionals to be established in St. Maarten. The second one is the national ordinance on practice of medicine. This legislation outlines the requirement for a physician to be considered competent to practice medicine on St. Maarten and regulates the oath-taking procedure. Number 3, national ordinance regulating involuntary psychiatric care. This ordinance governs clinics, psychiatric care, including admittance and supervisions of individuals with severe psychiatric problems. And we have the national ordinance on healthcare institutions. Keeping this ordinance contains all regulations regarding healthcare institutions. It stipulates which activities are required, a permit from Minister of Public Health, Social Development and Labor, and the procedures to obtain the permit. The ordinance also contains quality requirements applicable to healthcare institution regulations and the mandatory complaint procedures, as well as specific stipulations regarding hospital facilities and laboratories. I would also like to touch on the Vietlander. In the Vietlander, the signing of an agreement for all 4 countries to work together. The signing has intensified the existing cooperation in various areas. The organization will work together, especially in the field of quality of care, legislation, and education. This means, for example, jointly setting up training opportunities for psychiatric nurses to become available within the region. During my trip to Aruba, it was agreed that all islands will commit to working together to improve the quality of mental health care. We will work together in a team of development of care, quality, legislation, regional training. The aim is to also be able to make better use of each other's expertise. Mr. Chairman, that is it. I look forward to any questions from members of Parliament.
Thank you, Minister, for the presentation. I was also informed that this presentation has been shared with the members of Parliament as well. Members of Parliament, the floor is open to any of you who would like to make any comments or pose some questions to the Minister. To whom can I give the floor? Take a look, 1 second. I believe the first will be MP Westcott Williams, yes? MP Westcott Williams, you have the floor.
Thank you once again, Mr. Chairman, and thank you, Minister, for the presentation. Indeed, it has been shared with the members of Parliament. Mr. Chairman, I believe it was in late 2021, maybe, the Parliament received a very urgent letter that was sent to the Minister of Justice regarding forensic care and government's collaboration in providing forensic care. That letter came from the prosecutor on St. Maarten. And it was basically a tap on the wrist of government, because according to the letter at the time, there was supposed to be a task force established and including the professionals, etc., but government did not respond. Subsequently, the prosecutor's office was kind of hesitant to go back into this matter with Parliament when I questioned the letter that was sent to Parliament. But specifically, my question to you, Minister, are you aware of any specific actions under the umbrella of mental health care regarding forensic care? So is that anywhere, anything in some of the plans that you have outlined there? Secondly, Mr. Chairman, I took note of the minister's press release regarding the meeting with the APAP, Association of Psychologists and Allied Professionals. And I also saw where the matter of these professionals having to pay turnover tax was brought to the attention of the minister. I also read of the minister's response that he would check that out with his colleagues. I can inform the minister, this matter, I have put it on the table of your colleague, the Minister of Finance, for a while now. It requires just what I would consider a simple change to the law. That took a while, but I have also noticed that that proposal is now with the Council of Advice. So if you didn't get the information from your colleague yet, I can share this with you, because I met with representatives based on their request, and therefore my efforts with the Minister of Finance. But apparently the change has been proposed because, as I informed the Minister of Finance, unlike the other islands, like Curacao, for example, these professionals were not excluded from turnover tax, while different medical professionals are. So just that you know where that is at. Thirdly, Mr. Chairman, the matter of the evaluation that was part of the presentation, is that something that can be shared with Parliament, the evaluation of 2021, if it was done before, then if that could be confirmed, not as far as I can remember from documentation received by the minister, but yeah, what did that? I would like to see what that evaluation has yielded. Mr. Chairman, I want the minister to know that just like for other areas, in the area of mental health care, I completely support the ministry's approach towards a community approach where this is concerned. Not only in this case, I believe it's definitely something that government should be looking at in most areas, something that I call kind of decentralizing the responsibilities that government has and putting them in the hands of persons on the ground, so to speak, with, of course, the necessary tools and resources. Then I have the question for the minister regarding if there's any update to be given on the general national health insurance. So giving coverage to as many persons as possible, ideally everybody. So is there anything the minister can update us where that is concerned? And then my final point for right now is whether all that has been put forward, if there is some timeline that can be given in terms of change legislation, when can we look forward to that, in terms of steps to be taken, further agreements to be signed, the report to be completed, etc., etc. Mr. Chairman, I want to leave it here in this round or this session. Thank you.
Thank you, MP Westcott Williams. Now we have MP Gums.
Thank you, Mr. Chairman, and good afternoon to you, my colleagues who here, to the Minister and his support staff and those joining us. Minister, thank you for the presentation. I just had a question with regards to where, for example, Turning Point falls in all of this, because mental health foundation is one component of it, yes, but with Turning Point, people can have mental issues that are exacerbated by drug and alcohol addiction. So it's completely different to the care that Mental Health Foundation offers. So if you could share a bit more on where Turning Point lands in the plans that you presented. Thank you, Mr. Chair.
Thank you, MP Gums. MP Bijlani, you have the floor.
Thank you, Chairman. Good afternoon to you. Good afternoon to the greffier, to my colleagues here. Good afternoon to the Honorable Minister and the staff, and good afternoon, St. Maarten. Quite interesting, the presentation. The first line, currently over 200 professionals working in the sector. Very eye-opener. But when I read the second one, from social worker, house doctor, psychologist, psychiatrist, nurses, ambulance, pharmacies, the division becomes very small. Could you let me know exactly how many in each category do we have? The 8 million approved by NRPV, is it for everything that the vision is? Address the outdated mental health legislation, strengthen the primary care and prevention programs, build a new facility. Is it for all of that, or how is that 8 million going to be used? And the last important one. I've come across a lot of students residing on the island, but not born here or whatever it is, who willingly have come back to be in this profession of medicine, and they're given hard time due to big legislation. Is there any softness done on that? People who have come back, love the island, and not getting placed rightly in the right place. Thank you.
Thank you, MP Bijlani. I don't see any speakers at this time wishing the floor. Minister, I do have a couple questions that I wanted to add. Specifically, does the ministry or maybe the Mental Health Foundation, Turning Point, or others, what information do we have in terms of the diagnosis of various mental health disorders in St. Maarten? Or do we have even like on a survey level to have an understanding of what is prevalent in our country? There are many, of course, forms of mental health issues or specifically disorders, diagnosed disorders that can exist. In some countries, they vary, but one in particular that is extremely very prevalent, it's the borderline personality. In America, it's 1 in 6 members that live with this, and I want to know how many, do we have any diagnosis or statistics on how prevalent this is in St. Maarten? As someone that lives with borderline personality myself, I can understand that not understanding yourself and your mind can be a challenge for you to understand why you are the way you are and how you think, why you think the way you think. And sometimes it's as simple as understanding, giving those statistics can also help taking away the stigma that, hey, it's not, you're not, you know, a unique person. This is actually quite common, and it's okay. It's more common than the flu, actually. It's a matter of understanding the way you think and actually using it as an advantage, because if you understand the way your brain works, you can actually formulate it to excel in your profession. So I think that's important and will help pretty much with the stigma that is there. In the school, in the area of education, particularly in our schools, you know, we always talk about, you know, where you see fights happening and so on. What level of care is given and collaboration is given between the Ministry of VSA, mental health institutions, and the educational sector in addressing and those type of things to understand if some of these outbursts that you get or these cries for help might be related to mental health assistance that these students might need. It can be trauma from home, it can be trauma from things that happened in the past that are manifesting in the classroom and the schoolyard. So I think it's also important to have an idea of what's happening in our schools. So those would be the 2 additional questions I have. Minister, you've received a few questions. I would ask how much time you think you might need to answer. Yes, Minister?
If you permit me, because I want to be complete, so
Yep.
can I have 30 minutes?
Sure, not a problem, Minister. So members of Parliament will round it up to 1 p.m. and we will return here at 1 p.m. for the answers from the Minister. Thank you, Minister.